When massage doesn't help you with your jaw pain and stress and sleep is becoming increasingly harder for you to do, how do you ever find permanent relief? Keep watching and you'll find out. Chronic jaw pain isn't a simple fix. If it was, the massage and stretching you've been doing would have helped you by now. The truth is, jaw pain is usually a very complex problem with a multitude of factors contributing to it. Each of these factors need to be addressed. The primary cause of jaw pain is usually due to excessive clenching or grinding of your teeth when you're sleeping. Clenching and grinding are a result usually of two factors. There's a stress component and there's an emotional component. Stress. We live in a very toxic world and a very hyper-stressed world, especially now with COVID going on. So what I'm going to do right now is I'm going to explain to you some tips that you can use before bed to help your body de-stress itself. The first thing that you can do is start to unplug your electronics before you go to sleep. This means shutting off the TV, shutting off your iPhone, and getting off of the iPad. The blue light emitted from these devices tend to keep our body more alert. The second thing we can do is change into our pajamas. Changing into our pajamas psychologically is telling our brain, guess what? It's time to get ready for sleep now, so we can slowly start to calm down a little bit. The third and final thing that we can do is about an hour before we go to sleep, dim the lights in your house a little bit and have very light, low volume conversations with loved ones. You could drink a glass of warm tea, you can meditate. These are all signs and actions that we can do to help the body decompress before we go to sleep. So besides stress, another component that contributes to why we clench and grind our teeth when we sleep is there's an emotional component. If you think about the jaw, what is the jaw? The jaw is our ability to communicate. What I mean by this is that society has forced us to become okay with biting our tongue. We've all heard that expression. But really what that is it's our inability to articulate or communicate what we're trying to say. And as a result of that, we have to bite down and hold our tongues in, meaning we're clenching our teeth. So think about it. If you're upset at a loved one, if you're upset at a boss, if you're upset at something that's going on within your life and you don't feel comfortable enough to express it, we suppress it and it builds up in our body as stress. And when we go to sleep that night, we end up clenching and biting down more. Another reason why you might be feeling tension in your jaw is because you're not obeying the sit, slide, lean rule. With most of us working from home these days and having makeshift workstations, our posture might not be the best. So what happens is we tend to lean forward. As we lean forward, our heads jut forward, and over time this puts more pressure on the muscles of the jaw here. This is why it's very important to always obey the sit, slide, lean rule when working from home. If you've been clenching, grinding, or have tension in your jaw, what is actually bothering you? You have a muscle here on the side of your head called your temporalis muscle. You have a muscle here on the side of your jaw called your masseter muscle. There's a muscle deep inside your mouth called the medial pterygoid muscle. When these muscles are overused or you're clenching and they're always contracted, what's happening over time is your body starts to lay down adhesion. How would you even know if you have adhesion in your jaw? Has your jaw ever clicked? Has it popped? Do you ever get headaches that feel like it's stemming from the jaw and radiating up into your head? Do you ever get random ear pain that correlates with your jaw being tight? These are all symptoms associated with the muscles of your jaw not being able to lengthen and contract correctly, most likely due to the formation of adhesion within these muscles. This is a sneak peek of what adhesion removal of muscles of the jaw look like. Our cameraman Greg suffers from jaw pain along with inner ear pain, which no one's been able to help him with. The muscle I'm treating here is the medial pterygoid muscle. This is a muscle that you have to treat it inside the patient's mouth. Managing your stress, developing a sleep routine, proper workstation ergonomics, and being able to openly and freely express yourself are all awesome ways to help prevent adhesion from forming. What about the adhesion that's already there? That stuff has to be manually removed. So if you are at home and you're fed up and you've had jaw pain for longer than 6 months, have gone to 3 to 5 other doctors and are still looking for results, send us a DM, give us a call, and I'd love to talk and help you. Have a great day, everybody.